Ever wake up with crusty stuff in a corner of your eyes and think, what is that? And should I be worried? Let's talk about those little clumps that we call eye boogers because they're more important than you might actually think. I'm Dr. Anthony Mitchell. I'm a practicing optometrist in the state of North Carolina, and today we're breaking down something super common but rarely explained. The gunk you find around your eyes when you wake up. Some people call it sleep crust, others call it rheum, or just eye boogers. But what's actually in it, and why does it build up at night? And when is it just normal versus when it's a red flag? Let's get into it. What you're seeing is actually something called rheum, and it's made up of mucus from your eye's surface, oil from your glands in your eyelids, dust and particles from the air, and this might surprise you, dead skin cells that come from your cornea. The cornea is the clear dome-shaped front part of your eye, and it plays a major role in helping you see. In fact, the cornea provides about 2/3 of the eye's total focusing power. It bends and directs light onto your retina so you can see clearly. But because the cornea is always exposed to light, wind, dust, and friction from blinking, it needs to constantly renew itself. That means the outermost layer of the cornea cells is shedding and regenerating all the time. And when those microscopic skin cells get swept up in your tears, they become part of the debris you wipe away each morning. So yes, some of what you call eye boogers is actually your body's way of keeping the surface of your eyes healthy and your vision sharp. When you're awake, blinking and tear flow remove those particles. But when you're asleep, blinking stops, tear production slows down, and everything just collects in your corners. And that's what you see every morning. Okay, so let's talk about what causes it and what can make it actually worse. Some eye discharge is totally normal, but several things can make it more noticeable or more problematic. Let's break it down. One thing that causes it to be worse is dry eyes. When tear production is low, your eyes can't flush out the debris efficiently. Makes sense, right? Next is allergies. Inflammation can trigger excessive mucus and oil. Screen time lowers your blink rate, leading to dry, unstable tear film. Air quality. Exposure to dust, smoke, or pollutants can irritate the eye. And then infections. Infections like bacterial or viral conjunctivitis can increase the yellow or green discharge in your eye. But here's what most people don't realize. Overwearing contacts can absolutely lead to more eye discharge. Why, you ask? Because contacts reduce oxygen to the cornea, especially when they're worn for too long or when you sleep in them. That leads to dryness, irritation, and an inflammatory response where your eyes produce more mucus and tear film debris to protect themselves. Also, contact lenses can trap allergens, bacteria, or particles underneath them, which then further disrupts the cornea surface and in turn increases discharge. And then there's eye rubbing. When you rub your eyes, especially if they are dry or tired, you're mechanically irritating the conjunctiva and the eyelid glands. This stimulates even more mucus and oil and cellular debris. Plus, it can push material into the tear ducts, clog them, and trigger an inflammatory response that can worsen discharge. So contacts plus rubbing equals more gunk, more irritation, and more reason to give your eyes a break. Now, not all eye boogers look the same, and that actually matters. If it's dry and flaky, that's typically normal. Sticky or stringy, that might be allergies or some mild dryness that you're having. If it's yellow or green, that could be a bacterial infection. If it's thick, smelly, or constant, that may signal a blocked tear duct or a chronic issue. Also, look out for symptoms like redness, pain, light sensitivity, or swelling. If any of those show up alongside the discharge, it's definitely time to call your eye doctor or come see me. So while you're deciding if you should go to the eye doctor or not, have you noticed that your pet sometimes gets it too? Yep, I'm talking about your dog and your cat. That little crust in their eyes, that's the same thing. It's their version of rheum. And just like humans, a little is normal, but a lot could mean a trip to the vet. Okay, let's talk about how to fix it if it's kind of like a mild thing. So like if your eye discharge is mild, occasional, or just in the morning, here's what helps. Use a warm compress in the morning to gently soften and wipe away the buildup. You can also use artificial teardrops during the day to just help flush out any irritants and keep your tear film balanced. Clean your eyelids using a hypoallergenic lid wipes or just use diluted baby shampoo. Also, you can run a humidifier at night if your room is very dry, especially in the winters. And if you wear contacts, just make sure you're not wearing them longer than recommended. Never sleep in the lenses unless they're approved for extended wear, and even then that's probably a stretch. And if you feel dry or gritty with the lenses in, just give your eyes a break. And lastly, turn off the fan at night. Now I know the fan might make you feel comfortable at night, but it's probably the main problem that you're having, and that's why you wake up with dry eyes and eye boogers in the morning. But anyway, that's a different story. So here's the bottom line. A little eye crust in the morning, that's normal. A lot of discharge or anything painful or smelly or colorful, that is not normal. Your cornea plays a huge role in keeping your eyes and your vision clear. And shedding those outer layers is just one part of your eye's amazing self-maintenance system. But things like contact lens overwear, allergies, and rubbing your eyes or poor hygiene can throw off that balance, and your eyes will definitely show it. So if you're seeing more eye boogers than usual, it might be time to check your habits, or just go check in with your local eye doctor, or like I said before, come see me. Hopefully this helped clear things up. If you learned something new, please hit the like and subscribe button, and I'll talk to you more about eye health and other related issues in the next video.